Hi, everyone. I'm Thompson Duncan, along with William High, Celeste Land, and Thomas Riley LaChance. And for our project, we decided to go with the mystery of placebos and their effectiveness. And placebos are a form of medical treatment that is non-pharmacological, meaning there are no drugs in use. So, for example, a doctor might give a patient who has a headache a sugar pill as a placebo. The way this works is by enacting similar parts of the brain that the patient would be using had drugs been used. For instance, if a patient was given a placebo and was told that it was an opioid such as Oxycontin or Vicodin, the placebo has the potential to allow the patient to produce natural opioids in the brain due to the patient's anticipation for relief.
Thompson, this is you.
Oh, God, I'm so sorry. I forgot.
Okay.
Keep rolling.
Keep rolling. We got it.
Okay. For this study, our methods consisted of analyzing multiple professional studies that other people conducted, and we researched clinical trials and came to conclusions regarding the efficiency that placebos offer. Each of these experiments attempted to study how placebos impacted various aspects of modern medicine, including psychological well-being and physiological well-being.
So the first study that I researched was from 2008 and from Denmark, and it found that 48% of doctors had prescribed placebos at least 10 times within the past year. So obviously, a lot of doctors are using it, and it is at least somewhat effective. So the majority of these placebos were antibiotics for viral illnesses and vitamins for fatigue. And then I was reading another article from the U.S. National Library of Medicine study from 2013. And this study compared placebos with no treatment in 3-arm trials. So these 3-arm trials were no treatment, placebo, and treatment. And what was really interesting was that with continuous outcomes, where N was equal to 115, there was no difference between treatment and placebo effects. But in the binary outcomes, where N equals 37, the treatments were notably more effective than placebos. And then lastly, in the no bias trials, placebos were more effective than treatments. So what does this all mean? So basically, the efficiency and usefulness of placebos is an interesting and often debated inquiry within the medical realm. But I feel like most doctors and scientists agree that placebos are effective in continuous cases, but they shouldn't entirely replace conventional treatment measures. So this study basically indicates that patients will benefit most if placebos are employed in conjunction with these long-established treatment methods during these therapeutic regimes.
So the study that I looked at for this was conducted by Dr. Zubaydah, and it was funded by the National Institutes of Health. They were looking at the effects of placebos in the treatment of depression in order to gain a better understanding of how placebos work and how they could lead to the development of more effective therapies for mental disorders. So Dr. Zubaydah studied 35 participants that were all diagnosed with major depression, but none of them were taking any medication at the time. The experiment had 2 phases. So in phase 1, all of the participants were randomly assigned like a type of placebo pill, but they were described in different ways. So the first type of placebo pill was described as a fast-acting antidepressant, and then the other participants were given an identical placebo pill that was described as a placebo. And then in phase 2 of the experiment, all participants received antidepressants for 10 weeks and were monitored. And then in all the phases of this study, they were documenting and filling out surveys talking about their symptoms. And then, so overall, like after the study, the researchers concluded that the participants reported a significant decrease in their symptoms of depression when taking the active placebo that was described as a fast-acting antidepressant compared to the inactive placebo that was described to the participants as a placebo. And so based on these results, you can understand that people are responsive to placebos. And additionally, in the article, it stated that people with depression benefited from the use of a placebo, showed signature changes in the brain, and also responded better to subsequent medication. So this means that placebos could play a crucial role in medicine, especially when incorporated with traditional treatment and medication.
So another study that we looked at the contrasting effects of poison ivy and a harmless shrub associated with the placebo effect. And we were able to see how the body responded to this fake stimulus. And this study, there was a study group, and they were blindfolded, and they were exposed to a harmless shrub. And when they were exposed to the harmless shrub, the researchers told them that it was the poison ivy. And so the study group, they thought they were being rubbed down with the poison ivy, and that led to them scratching their arm, and which eventually led to more itchiness and more redness. And then they also reversed the experiment, and they told the group that they were being exposed to a harmless shrub when actually they were rubbing their arm with poison ivy. And then this led to 1 in 6 participants getting a rash. And then from this study, we were able to see the true effectiveness of the placebo effect. And we were able to see how effective the placebo effect was, especially when they were exposed to the poison ivy and they didn't itch. Usually when you get poison ivy, you itch it. But when they were exposed to the harmless shrub, and they started itching. So this study basically showed that the placebo effect is effective.
So in conclusion, placebos have the potential to serve as a cure in some cases. They have a high success rate when acting as a cure for psychological illnesses such as PTSD or even depression. And small things like pain management or nausea can be cured. However, in most cases, it's unclear whether or not the placebo is responsible for the success, or it could be the patient's recovery. So in other cases, placebo may not work at all. But as to cover a small cure, placebos could play a crucial role in medicine, particularly when incorporated with traditional treatment and medication.